minutes? If there are no additions or corrections to those minutes as published, I would be looking for a motion. We have a motion and support to accept the May 11th meeting minutes. All in favor say aye. Opposed, the same. Approved. DHS quarterly report. Hello, good afternoon.
Good afternoon, Commissioners. I believe that you have a report that I submitted earlier. It's a very brief report. Really what it just talks about is continuing to talk about the merger of the Department of Human Services with the Department of Community Health. So we are now the Department of Health and Human Services, or DHHS, which you may want to note on the agenda. For future, because that's what we continue to call ourselves and have to remember, the DHHS. We are really continuing to just be sort of updated from our central office in terms of what's happening at the Lansing level with the budgets being merged and looking at how the administrations are being merged. So we're sort of being notified as to who the executive level officers are and who our deputy directors are, but really at our local level, things are pretty much staying as they are for right now. So we are not seeing programmatic changes right now. We are not seeing budget changes as a result of this merger. We will potentially see that as the new budget moves forward, but right now we have not seen that. So we're just moving day to day, paying attention to the news and watching what happens as the memos come forward. But it's really been pretty much a smooth process for us at the local level here. We do continue to hear the message that they are committed to creating efficiencies and enhancing effectiveness for our customers. And so what we've started to do locally, and Mary Beth may speak more to this, is Mary Beth Leonard and I have started to set up monthly meetings so that she and I can talk about ways in which my office and Lifeways can work together to make sure that we are working efficiently for our community and for the folks who use both of us and both of our offices. And then we actually were just talking with Richard with the health department, because what the things that we have heard Nick Lyon, our new director, talk about is how the three of us as the Department of Health and Human Services, so you've got public health, community health, and human services, how we can sort of work for this no wrong door. If someone has a need and they go to the health department, or they go to Lifeways here in Jackson, or they go to human services, how we can make sure that if they come to my office but they have a mental health need, I make sure that they get to where they need to be at Lifeways. Physically, in Jackson, we are still so far apart, we're sort of trying to figure out how we can work that out. So we're at the very beginning of that, but it's kind of exciting to think about how we can do that. So that's sort of what we're working on. The only other sort of major thing within my office, and I've mentioned this in previous meetings, adult services. So in my office, adult services does adult protective services. It handles independent living for elderly, and we do chore providers, chore services, payment for those types of programs. That program has sort of moved around a little bit in terms of who's responsible administratively for it. They created a separate business service center for adult services, named it Business Service Center 6, and moved adult services under that business service center late last fall. And they just recently told us that they were moving adult services now back under each of our local business service centers. So Jackson and Hillsdale counties are under Business Service Center 4, and our own adult services are going to stay with us, moving it back to us sort of locally again, which, again, I think is a better move for us. It helps us stay more involved with what's happening locally, and our supervisor, our administration is more involved with that. So so that's a positive move for adult services, and helps them sort of, the administration, stay involved with the local piece. With regard to our child care fund expenditures, we meet monthly at our board meeting and review our expenditures, and everything is on budget with regard to our child care fund expenditures. So no surprises there at this point, and we are getting ready to move toward next year's budget, so we're all set with that. Any questions?
Comments or questions regarding the report? Commissioner Placzek?
Yeah, were Health and Human Services combined at one time, or are they in other areas?
In other programs?
Yeah, it just seemed as though at some time in my life, I remember the Departments of Health and Human Services being under one umbrella.
Federally, the Department of Health and Human Services are combined federally, so you've heard that term at a federal level. Locally, for the state, we've had different names. Department of Social Services, we've been called the Family Independence Agency, then the Department of Human Services. So in my 23 years, short term, this is our fourth name, but we have not combined with other agencies. Now, Department of Community Health and Public Health did combine. How many? 96. 96? Okay. 1996. So that merger happened some years ago, but the Department of Human Services still stayed separate until just recently.
Zoe, if I could ask you to offer some information to the board that I was made aware of at one of your last meetings. Mm-hmm. Could you explain to the board the financial implications for the county in regard to foster care, number one, and also what are our current needs within our community of foster care?
So financial implications, can you be a little bit more specific on what you would like me to speak to?
So when foster care is available and or if it is not available,
okay.
The implications for county funds.
Yes.
Thank you.
So when we have a foster home available, yes. So one of the needs that we seem to always have is finding the right foster home for children and enough foster homes for children. We just had a conversation today. I can just talk to you about children that we were placing today, actually middle of the night last night. 4 children, 4 siblings that we needed homes for. We were only able to find a home to take 1 of the 4 children. So 3 of the children had to go into a shelter that is in Oakland County. When children have to go into a shelter, the cost for the shelter is exorbitantly more than being placed into a foster home. So, and I'm not going to be able to say exactly how much, but it's probably compare it to from $13 a day to $100 a day. That's the difference. Funding sources, children's funding sources are different. So some children, depending on whether they come from a 2-parent home or a 1-parent home, whether the parents work or not, can be what we call Title IV funded or federally funded, which is not a cost to the county at all. But if parents work and if they're a 2-parent family, then they are county funded, and that is a cost to the county. So it behooves us to really try to have as many foster families as we can licensed, and to have those foster families willing to take as many children as they can possibly take. They can't always take 4 children because they don't have enough bedrooms, they don't have enough space, and also some of the things that we have difficulty with are older children. Some folks can only take, children from 0 to age 8, or 0 to 10, or even 0 to 4. Or that's all that they want. So we have some struggles when we go out and we recruit for foster homes where, we say how much we need foster homes, and people will say, well, I'm willing to open my home to take in children, but they only want babies. And so we have a lot of foster homes who are interested, but they only want babies, and then we get groups of 4 siblings, and none of them are babies. So we end up, and Julie, you had a situation where you've been out talking and saying we need foster homes, and then we have some licensed foster homes who say, well, I don't understand because I'm licensed, but I never get called. Well, it might be for some of those situations because you're only licensed for 2, or you're only licensed for the age 0 to 2, and we're trying to find homes for children who are from 4 to 15, and there's 4 of them. Or one of my coworkers in another county recently had a sibling group of 12, which is unbelievable. So it's one of these things where you just really can almost never have enough foster homes. The other thing that we are constantly trying to do whenever we do removals is always asking about relatives. Because the best thing that we can do for children is keep them with relatives if we can find safe and suitable relatives. But we don't always know that, for instance, in the middle of the night. So we may need to find a licensed foster home that will take children even for a short period of time until we are able to check out the relatives, make sure the relatives are okay, do the screening, go to the homes, make sure the homes are okay, and then we can go ahead and place those children with their grandparents or with their aunts and uncles where once they've been checked out. So it sometimes seems like it's maybe as simple as just recruiting and taking in some children, but it does become fairly complicated. Yes?
I'm sorry. I'm just curious. In the cases that you were talking about, where you have 4 children that are siblings,
Yes.
and only 1 is placed in a foster home, and the other 3 are sent somewhere different.
Yes.
I'm just curious what measures you guys take to keep them in contact with each other.
We're required to make sure that they have visits. So first of all, so that happened today. We're going to continuously from now until they're actually placed back together, try to get them into the same home by looking for relatives and by looking for a foster home that will take all of them. But if we can't get them into a foster home that will take them together or with a relative, they will definitely have visits at least once a week. Depending on how old they are, if they're younger, they'll have them more than once a week with each other and with their parents. So they will see each other when they see their parents, and then they will see each other as siblings as well.
Also, just curious, were they split just for the sake of cost, because it's cheaper to send the 1 to a foster home and the other 3 that weren't available to be placed in that home? Or?
No. I mean, we would want, if we can find a home for any of them, we would want them to go into a home, a family-like setting, if at all possible. My guess is what happened is we found that family-like setting for the 1 and continued to try to find the family-like setting for the others, but when we couldn't, we ended up having to take them to the shelter.
Just from an informational standpoint, how many children can you put into a room?
It depends on the size of the room. I believe there can be 1 child. I just went through this last week. I think it has to be at least 40 square feet for 1 child. So for every additional child, it has to be another 40 square feet. And then it also has to have an exit, so you have to have a window. And if it's a second floor, it has to be able to get out. If it's in a basement, it has to be an egress, all of those things. And they can't can't be a brother and sister once they're a certain age, and all those rules.
Thank you for that information. What other questions might you have for Zoe? All right, seeing none, thank you for that information.
Thank you, Julie. Thank you.
Okay, thank you. Next on the agenda, we have Lifeways.
Good afternoon. All right, in your packet, you'll have my report. As usual, I always have additional items since the time that I submit the report. There's activity that's been occurring. So I do have a couple of updates that are not on the report that I'll get to. But first wanted to let you know that our annual audit was completed and was presented to the board. I'm hopeful that next month we have posted for our CFO position and are in the process of looking at candidates. So I'm hopeful that next month that I can actually bring the new CFO here with me to kind of give you a brief summary of the audit findings, but they were very positive. And I'm sure that Commissioner Rice, who's on our board, could share that with you if anybody was curious about how that came out. The other thing I wanted to give you an update on was related to capital improvements. As you know, we've been waiting anxiously to get the information back from Tenco, who's working with the building authority in regards to the core samples to kind of find out related to our roof, what needed to occur, what sections needed to be repaired, and how we needed to proceed moving forward related to the bond. So we finally have those numbers. We'll be presenting that information to our Facilities Committee meeting this week. And from there, one of the things that we will be doing as a board as well is signing a resolution this month giving Mr. Shotwell, I just noticed his name is actually over here. Somebody's goofing around here, but to give Mike Overton authority to have us proceed with the bond. So that resolution will be occurring this month. The other thing that was in your packet to give you an update on was related to Mid-State Health Network. As you know, we are moving forward with the integration of substance use services with the regional entity now, instead of right now. Through our 21 counties, we currently have 3 coordinating agencies that oversee all the substance use service deliveries for all of those counties. And we're going to be merging that into one. The benefit to Lifeways and to the entire region is that is an estimated savings of $1 million. And that $1 million will actually come back down through to the delivery of services at the local communities. So that's a positive thing. The other thing that we're doing related to looking at where the PA dollars were, the fund balances, and really trying to say, okay, for each of the counties, this is the fund balance that's remaining, and how might we be able to meet the needs locally. And I've talked about what we're trying to do for Jackson County is related to a detox, expanding detox services, and also looking at an engagement center. So we're moving forward with that. And a lot, I would just like to say, could not have happened without Commissioner Rice's involvement as a part of that. He's on the board of the regional entity, and was a moving factor related to really pushing those local dollars and making sure that we're really putting them back at the local level, because they were holding on to them. So thank you for that. We appreciate that. The other thing that I wanted you to be aware of is we did receive our EARS accreditation. Probably not really sure that you even know what that is, but we do have the 211 that covers Jackson County. And it's a pretty prestigious thing that we were able to achieve a 5-year accreditation with 3 areas that were identified as best practice nationally. So that's pretty outstanding, and we're pretty proud of that as an agency. The other thing that I wanted you to be aware of was related to Healthy Michigan expansion. You know, the numbers are way higher than they ever anticipated. And what that has had is right now the waiver actually has to be resubmitted. So the state has to submit a waiver by September to continue with the Healthy Michigan plan expansion. Part of that also requires some, when Governor Snyder approved Healthy Michigan, he put in some things to really try to have ownership of the individuals related to Healthy Michigan, and some of that is increasing cost payments that people have, as well as following up with needed health issues. So you have to have an annual screening, and as part of that screening, if something is identified, whether it's obesity or smoking, that you actually take actionable steps to address those health concerns. If you do not, it's like some of the commercial insurances. I know Lifeways was a part of a commercial insurance in the past, where if you didn't follow through with your commercial insurance annual, the doctor's recommendations, you got thrown into the higher bracket related to co-pays and your deductible. It's the same thing with Healthy Michigan. We did some projections to look at what would that look like related to the population that we serve, and it's a small percent who's going to be impacted by having a higher increase of cost because of the fact of their income levels. But that is important to note, because we want to continue to work and ensure that all these people that have not had health benefits, that now do have benefits both from a mental health perspective and a physical health perspective, that they do follow through, and that we work to make sure that they're addressing those issues. So anxious to see that the state continues with the Healthy Michigan plan. But the other thing that's occurring when we look at Healthy Michigan is that there's been a shift related to individuals that were Medicaid with a disability, and related to funding, and being automatically shifted over to Healthy Michigan. We're looking at that internally as an organization, because that has a significant impact. Individuals that were deemed disabled and receiving Medicaid, their, for example, monthly per member per month is roughly $200. Healthy Michigan's monthly per member per month that the community mental health is paid to provide services is $29. Significant savings for the state to shift individuals to Healthy Michigan because it's fully funded. The concern is that the cost associated with the shift, and now you have less money to serve those individuals. That's having an impact statewide, and we are trying to address that issue. But why I bring that up is because that has an impact on general fund. And as you know, over the past year, actually year and a half, I've talked about the significant reduction that the community mental health has experienced related to general fund dollars. The state has also recently taken action related to state inpatient. So individuals that are placed in the state inpatient, the state is now going to be cost settling those at the end of the year. And what that means for an agency like Lifeways, who has done a really good job over the past year and a half, because of twofold. When we had our local match issue, and we knew that part of our local dollars go to cover the cost of individuals in the state inpatient, we really worked hard to reduce our state inpatient. I've shared that here before. We've gone from 12 down to 5. We may have 6 right now, but we've cut it in half. Your general fund dollars now are going to be reduced significantly as a result of that. So while we've saved money on the local match side, by not having that expense, now we're negatively impacted because we've been good stewards related to managing those costs. We're trying to take advocacy at a regional level related to this and the impact on the communities, because those general fund dollars, as you know, is what's used to serve individuals coming to our door who might need inpatient services or psychiatric services but don't qualify for Medicaid or Healthy Michigan. That's valuable dollars. But I just wanted to let you know that. You may hear about that, but we're trying to take some action to address that, because that has a potential impact of hitting Lifeways over the course of this next year of roughly $900,000. It's huge. The other thing that I wanted to share that we're working on is related to a partnership with Allegiance Health for their residency program. Over a year and a half ago, Allegiance had approached me in regards to looking at when they were bringing in this residency, and for their rotations, of having a rotation at the community mental health. And that's really important. It's important from many levels for them to be able to see the role that the community mental health has in its community, and for those doctors to understand how do you access services, how do you know when somebody is eligible. So we're excited about this partnership, and they will be starting rotations with us actually starting in July. The other thing that I wanted you to be aware of was that I talked last month about the fact that we had the suicide stomp that occurred at the end of May. And this was our first attempt at trying to raise funds. Usually we've had grants available in prior years to actually cover the cost of having a suicide awareness event. And we had a fundraising component related to this past year, and we raised almost $8,000, which will allow us as a community, because this coalition is not just made up of Lifeways, but it's made up of many partners in the community who want to have an impact on reducing suicide. So we were excited about it. We had over 300 people participate, even in the rain, and it was raining. So we were excited about that event. The other thing that I wanted you to be aware of was related to the partnership, and Zoe kind of talked about that we're looking at, related to how might we able to achieve the vision that the state has related to ensuring that there's only no wrong door access. So how might we look at our service delivery and partner related to public health, Department of Human Services, and the community mental health. So you'll hear more as we kind of just brainstorm and look at visioning down the road. But that is it for my report, and I'm available to ask questions.
Commissioners, any comments or questions? Commissioner Rice.
Just a couple comments. I'd just like to say, obviously, at one point with the local match and all, there was, to say the least, quite a bit of contention. But I can say from my position here as a county commissioner, but also as being on the board of directors for Lifeways, that several things have occurred since then. And just for my fellow commissioners to know that, Lifeways has done a lot to, and continues to do a lot to handle a variety of situations, to let the public know what's going on, that Lifeways has numerous kinds of services that the public is not even aware of, and a lot is going on to make them aware of that. The crisis intervention that Lifeways does is available to our law enforcement and others. I don't know if Mary Beth has actually spoke on that much, but that is something that's very important. And there's been several other steps that have been taken from my perspective that has helped put Lifeways in a much better position, and several things that Lifeways has done actually has provided Lifeways actually state and national recognition. So so even though we're paying a lot of money from our perspective, it's being well spent. Thank you.
Thank you, Carl.
All right, and also included in the board doc's presentation following her update, Mary Beth's update, with the financial statements, and the
Yeah.
audit report, so.
Oh, it was included?
Yes, it was
Oh, I
included
didn't
on
even
here.
know it was included.
Yes,
All right.
yep, no,
Karen's
we're
one step ahead of me then.
40
Awesome.
pages worth.
Oh,
yes.
yeah, okay. Well, I will, though, still put it on my report for next month
Perfect.
to give
That's
a
fine.
brief
Yeah,
update to the highlights of the report.
Absolutely, better to be safe
Yep.
and then have that way.
Okay,
Excellent, thank you. Seeing no other questions, thank you for that information.
all right, thank you.
Next on the agenda, we have Department on Aging. Marcy?
Good afternoon. Earlier this year, I reported that our senior nutrition site on the south side of the city was relocated to the Chalet Terrace Community Room, And we looked at it at that time that it might be temporary because of limited parking. And our nutrition services manager, Lori Carpenter, has been talking with the city Parks and Rec Department and looking at having the site moved to the King Center on Adrian Street. So we're moving ahead with that. And to let you know that a local person, Joe Evans, was chosen by the Michigan Office of Services to the Aging as the statewide Volunteer of the Year for leadership. So Joe is one of our volunteers at the Department on Aging. He does things, mature driving classes for AARP, and he's on the Jackson County Advisory Council on Aging. So, a couple other things that aren't on the report, informational for you. We did find out that the Elaine Apartments and their senior housing building downtown, that they are being sold to a new business, and they're waiting on HUD paperwork to go through, but they are making arrangements with the current residents to relocate them to other rental properties so the building can be renovated. And that should take about 6 to 8 months. But our staff person, Lisa Rudolph, our caregiver information specialist, she talked to the manager there, and it sounds like they're taking care of the seniors who are currently living there to find them another place to live, help them to move, and then remodel the building. I don't know if you know the history of that building, but the apartments are smaller. I know Otsego used to be, apartments used to be a hotel, and I can't recall if Elaine at one time was a hotel as well. So the remodeling will be nice, but in the meantime, people will be relocated. Yeah, just for your information. And also, last week, we received a thank you message from a family member, but it was for not the best reason, but they appreciated that when our driver went to deliver meals and the person didn't answer, then the routine is that we call the emergency contact person, and when they went to the person's residence, he had passed away. So they just appreciate that our drivers are there to check, if people are home, and if not, then we have the emergency contact person get a hold of them. And on a rare occasion, if we can't get a hold of the emergency contact person and we wonder if something could be wrong, then we will call 911 and do a well person check just to go in and see if they're okay.
So does your driver make a phone call back then to your office to get that number? They don't carry it on them, or per se,
Correct.
but
They
follow through the
they have a
procedure?
cell phone that each route has, and they call back to the office, to the meals clerk. They contact the emergency contact person.
Okay, so it's not the driver contacting someone from your
Correct.
department? Well, it obviously paid off in this occasion.
Yeah, it happens probably twice a year that it happens, so, yeah.
What other comments or questions might you have for Marcy? Seeing none?
Okay.
Thank you.
Thank you.
Next on the agenda, we have the Health Department. Good afternoon.
Good morning, afternoon, I guess it is afternoon. Very active month of May, if you will, that I've prepared for you in my report, and I have a few other items to share as well that aren't in board docs today. Under our administration, on our first page, we talked about a public health alert that the Health Department disseminated to community partners. We continue to see problems with people being very creative in terms of creating new chemical compounds and substances that are harmful to public health, and synthetic marijuana was a new one that was a new drug that was kind of created. It was identified as an emerging drug of abuse in 2015. The alert is actually in board docs today, and you can look at that as well. It has really fundamentally the same kinds of effects that we have seen previously in synthetic marijuana that's been distributed across the state in many communities. And one of the other things that we learned today as well is that sometimes synthetic marijuana is also in a powdered form being sprayed onto or people are trying to use it as well in e-cigarettes. So there's a lot of concern out there right now about e-cigarettes in general, although I don't have a lot of information in my report here for you today about it. We learn a lot more about the potential health hazards and concerns associated with e-cigarettes. at our State Association Board meeting this morning. So I'd like to bring more information back to this committee and to the board in general through a study session in a future meeting, because there's a lot I think you need to know about relative to these particular products, how unsafe they really can potentially be. So I'll plan to do that hopefully in your next study session. Participated in a meeting with the school superintendents on May 15th. It was a follow-up meeting really from the health department to communicate back to them how well we're doing, if you will, as a community in terms of both vaccination levels and waiver rates, but also to talk with them about the communicable disease reporting that all the school districts are required to do building by building on a weekly basis to the health department. It really does help us keep track of and monitor what's going on with respiratory and gastrointestinal disease in the community. In your report, as part of board docs, you'll see that we have a little quick thank you chart that we developed that was shared with the school superintendents. And basically what we've been able to do in the past school districts was to achieve a 100% participation rate by all school districts in the community. And we saw an increase of 33% from the 67% reporting rate in the previous school year, and a 24% increase in 100% reporting on a weekly basis from the 43% reporting rate in the 13-14 school year. So we're making great progress, and we also are planning to roll out our online disease reporting system this fall for the next school year. We've been working on that for almost 12 months at this point in time with the county IT department, and that'll be another way for the districts to be able to report to us.
Richard, if I could ask you a question at this point. In your conversation with the superintendents, you're stating that they have the obligation to report, however they weren't, but now they are.
They are.
Okay?
Yes.
I would ask the question, was there any financial incentive or for them to
No,
follow the protocol?
well, there's kind of a negative,
state and,
there's a negative
negative.
financial incentive.
Okay, just
But
the opposite.
we didn't go there and have that conversation. I think that they all knew that under the Public Health Code, they're required to report, and that's really what we focused on.
Excellent.
And trying to make it as easy as possible for them.
Okay.
And we're pleased that they were able to do that with us. We have a potential new healthcare organization, if you will, that may have a presence in Jackson County that would start potentially next January. The name of the corporation is Centene Corporation, and they are currently bidding on the Medicaid and Healthy Michigan Plan rebid that's taking place this particular summer and fall. And the state is now requiring that the rebids for the Medicaid plans take place on a prosperity region. So Jackson County's in Prosperity Region 9. So we've been approached actually pretty frequently over the past few months by different companies and organizations that want to bid on the region, and they're trying to establish contractual relationships with us, if you will, for the potential awarding of a bid for those companies in January 2016. So we've been meeting with them. We met with Centene Corporation here recently, and we would be interested in contracting with them if they're successful with their rebid, or their bid, if you will, for our region. A lot of busy activity also with health integration work. As I've indicated in my report on page 2, I've been participating in a couple of different events now on community resourcing in the emerging collective impact environment. And collective impact is really fundamentally about coming up with a common shared agenda, mutual accepted goals and objectives, a way of communicating very effectively across our organizations, much like the work we do in the Health Improvement Organization Coordinating Council. That's a good example of collective impact. But we also want to begin to pull the community together kind of in a broad way also, from the resourcing side, from the nonprofit organizations that we work with, and also from the Community Foundation as well, and other organizations that provide resources. So we've had a couple meetings now on that, and we're excited about continuing to work to make that alignment work as effectively as possible. I've been participating in a strategic planning process with the Jackson Health Network. That's going pretty well. It was a very interesting presentation by Tony Rogers, who is with Health Management Associates. He was a deputy administrator in the Center for Medicare and Medicaid Services, so he brought a lot of information to us for our review, and I thought it was very helpful. And the Community Health Assessment Ad Hoc Committee continues to meet to produce the 2015, if you will, Community Health Needs Assessment Report for Jackson County, and from that will come a new updated action plan as well. We had our first meeting with key stakeholders on the Immunization Action Coalition on May 13th, and we are planning to have kind of a first broad community partner invitation and meeting scheduled probably in the first part of October timeframe. We're currently identifying all the partners we want to integrate with, and we'll be having that first meeting in a broadly invited fashion at that timeframe. I included in your report a copy of a recent Department of Health and Human Services report on the cost savings to Medicaid from the Maternal Infant Health Program due to reduction in preterm birth rate. That is one of your attachments, or one of the items in your board docs. And I guess I wanted to just kind of highlight what's not included in this analysis. And although for every dollar spent, $1.38 is achieved in savings in terms of preventing preterm births, there's a lot more costs that are associated with it that weren't necessarily captured. So preterm infants are more likely to require additional and expensive medical attention during the first year of their lives, and they're more likely to have developmental disabilities requiring more interventions in subsequent years than full-term infants. That was not captured in this study. And then also the additional time and resources required to seek adequate care for preterm infants that parents encounter is a real financial burden for them. And the cost of hospital stays of mothers of preterm infants are also higher than those of mothers of full-term infants. So I think that the actual return on investment is probably closer to 2 to 1. Just isn't reflected there at this point. We got some good news that we'll receive some one-time supplemental funding for what we refer to as waiver education for vaccines. At the Health Department, it's going to be approximately $16,000, and this was a result of the CDC asking the Department of Health and Human Services if there was something they could use some additional resources for, and our immunization program director was quick on the draw and indicated yes. We implemented the waiver here in Michigan with the new communicable disease rules beginning in January of this year. So while we've been doing it for 2 years already in Jackson County, a lot of other health departments in the state had not previously had a policy in place, so they're looking at a rather significant impact come this fall. So we're pleased that they were able to do that for us. It'll help offset some of our local costs. The county employee flu shot survey was closed last Friday, and so staff at the health department will be analyzing that, and I hope to have a report for you on anything that we would recommend from that in the next monthly report. You also have an attachment on teen pregnancy and birth rates update, if you will. I won't go through the detail that's in the facts at a glance, but I just wanted to point out to you that what you don't necessarily see in that report that reflects a lot about Jackson County and the city as far as birth rates and teen pregnancies is that we actually have improved. You can't tell that from this report. So I want to share that with you. We are now 20th out of 83 counties in the state. We were 15th last year, so that's an improvement. Our ranking for teen birth rates is now at 23rd highest, and last time we were 17th highest. So we're making progress every time that we get an annual report that we can share with you. Still, the city of Jackson has ranked as number 1 highest among cities with populations over 20,000 for the past few years. We're at number 6 now. And that maybe is perhaps not necessarily a change, but the City of Jackson 2012 teen birth rate was 84.2 per 1,000 teens, and we are now at 67.1. So we're continuing to move in the right direction here. So we're very pleased with the efforts of the Teen Pregnancy Prevention Initiative and all the members of that organization for doing the great work that they're doing. I provided an underage distracted driving update for you. So far, we've reached over 260 students to date, and that might be a little bit higher than that because we're closing out now with the school year ending. Under environmental health, annual food establishment licenses, last week of April proved to be very busy at the environmental health counter. We always do provide May 1st as a grace period, which is basically an additional day. And pool inspection season has arrived as well. Back on April 27th, the animal shelter staff, and along with Dr. Anderson, hosted a workshop for law enforcement, which was very well attended. was called Animal Laws and Regulation, How to Handle Difficult Animal Situations and Enforce Public Safety. And I think that our law enforcement members in the community have done a great job in terms of stepping up to the plate and working with the animal shelter to make sure that they understand how to capture animals the best way that can be done, and done safely and humanely, both for the officers and for the animals that they're picking up as well. So it was well attended and was a really good event. We've made progress on the cat colony in the animal shelter. Those new cage fronts were installed. The county spay neuter project, cat project took place on May 3rd. I don't know how many cats were actually spayed or neutered, but it has been an objective each time they do it to do up to 100 cats in a day. So that's a very busy day, obviously, for the veterinarians. Animal shelter tours continue to take place. Cub Scout Pack 339 made a nice donation to the shelter with food, litter, and toys and other items. And this is kitten season, so intake activity at the shelter is normally high this time of year, and that's what we're seeing as well. A couple other things I wanted to bring to your attention that are not in your report. And you probably have heard something about this just by paying attention to the media a little bit. But we received an alert back on end of May about highly pathogenic avian influenza advisory from both the CDC and from the Michigan Department of Health and Human Services. We haven't had any of these strains recently detected in the Midwest. Well, actually, they have been detected in the Midwest, H5N2 and H5N8, and they're primarily affecting turkey and egg-laying chicken flocks, but we have not detected the virus so far in Michigan. But I do know that for the Jackson County Fair this year, we've actually canceled. There will be no waterfowl and poultry demonstrations or displays at the fair as a result of that this year. So I think that's a prudent measure to take until we know exactly what's happening with this particular pathogenic influenza strain that's affecting primarily flocks in the Midwest. We have received a lot of information, though, on what we would need to do potentially in the event that we had exposed poultry workers. The testing and the criteria for evaluation and diagnosis in the event that this might move from poultry or waterfowl into humans has been identified and studied, and so we would know what we'd be doing. Chances are it probably would start out, if anyone was exposed, we would immediately look at a similar monitoring situation to what we do now for Ebola virus disease, and track people to make sure that they're not developing signs and symptoms consistent with exposure to the virus. The other item that is also virus-related is on May 15th, the Department of Agriculture and Rural Development notified us that there were 3 dogs in Michigan, 2 dogs from Kent County, 1 dog from Macomb County, that tested positive for the H3N2 strain of canine influenza. So it seems like just about every creature out there is potentially affected by influenza in one way or another. It is a highly contagious respiratory infection in dogs caused by an influenza virus. It's not been found to cause human disease at this point in time, and we did receive a number of talking points on that from MDARD, and those have been shared with the shelter staff, so they're very much aware of the presence of the virus in Michigan. And that's pretty much my report. Be happy to answer any questions you might have.
Commissioner Rice?
Thank you for the report. I've mentioned this a couple times, probably more than a couple times. Just clarification again, when you talk about teen birth rate, we're not necessarily talking about teen pregnancies. We're talking about, obviously, what it says, birth rate, correct?
Correct.
So do we have numbers of the number of teen pregnancies as opposed to birth rate?
We do?
And I believe, if I may interject, on your board docs, we have facts at a glance, and there's a significant amount of data in there regarding Jackson County and even some statistics in regard to pregnancies, abortions, complete pregnancies, et cetera. So there is some factual information here that you've included.
The teen birth rate is always a combination of pregnancies, abortions, and miscarriages. So it's an estimate that's derived from those data across those three spectrums, and that's how they estimate what the teen pregnancy rate is in each community.
Okay, I appreciate that. The only reason I brought it up is because in 2013, we had 258 abortions in Jackson County that were documented. In 2014, it's gone up to 318. That's the reason I brought that up. Thank
Okay.
you.
Yep, you're welcome.
Commissioner Placzek?
For lack of a better, I don't have all the initials in front of me, so I'm just going to call it the bird flu. So how is that transmitted? We were talking about that earlier today.
Okay. I think I have some of that information here. Well, first of all, what we know is that the majority of the infections have occurred in poultry, but it has included backyard and commercial flocks. People usually, when they have contracted an infection from highly pathogenic influenza associated with avian flu, it's because they've come in contact with direct care of the birds. What it indicates here is previous human infections with other viruses, avian viruses, have most often occurred after unprotected direct physical contact with infected birds or surfaces contaminated by avian influenza viruses, being in close proximity to infected birds, or visiting a live poultry market. Human infection with avian flu virus has not occurred from eating properly cooked poultry or poultry products.
Our question, though, was how do the birds transmit it from flock to flock?
Well, I think that the thinking is that the avian influenza viruses themselves are coming into the country through the flyways and pathways that cross the United States. So however the contact takes place between, say, wild waterfowl and domesticated flocks, well, we think that that's the transmission point that occurs there. And it probably could be contact by domesticated flocks with the feces of infected birds, and that is likely how it happens. And once it gets into domesticated flocks, then people who are having direct contact with those flocks, including slaughtering and exposure to feces, can become infected. That's what we saw happen in China a few years ago.
Mr. Shotwell?
When we were dealing with the West Nile virus, we were asked to return birds of certain species, the first ones found in the county, to the county health department. Is there an expectation of the same thing with wild flyway birds?
I'm not so sure that there's a plan to actually collect the birds, if you will, but there is a telephone reporting system that's in place, both still for West Nile virus, in terms of being able to report dead birds. And that same system is now in place for highly pathogenic avian influenza.
Good question.
So, but I do think if the Department of Agriculture suddenly received a lot of reports of dead flocks, either poultry or waterfowl, I'm kind of betting that some additional collection of dead animals would occur and some testing would occur as well. But once you find it in a community, it's just like West Nile virus, once you find it, it's always there. So there's no need to keep testing, but the reporting is appreciated.
All right, thank you. Seeing no other comments or questions for Director? Thank you for that
Thank you.
information. Next on the agenda, medical care facility. Director, please.
Good afternoon, everyone. Our first pillar is finance, and I'm happy to say that our cost reports for Medicare and Medicaid were submitted and submitted timely. It looks as though our rate will be going up, and we'll get confirmation of that for our Medicaid. It looks like our rate will be going up. Our AR days are out 55, which is pretty normal for our business. Census has been up throughout the entire year so far. We've been running 96, 97%, which is really, really good. Our audit was turned in and a copy provided to the county. All of our financials, AP processing, AR bank statements have all been acted on and acted on appropriately. We monitor hospital admission rates, and I've been keeping you abreast of that. We did go up a little bit last quarter to 11.48, which is still 5% below the expectation from the federal government. We have audited and assessed our care plan processes to ensure that we're capturing coding correctly. And I was informed this morning that the state is starting their MDS-focused surveys, so it'll be additional surveys that we get each year. Under people, our M&A contract continues at a very slow pace, but we are moving forward. Our residents voiced no concerns that were of any major quality. There were a few small things about what dessert was served and that sort of thing during resident council. CNA attendance has improved a little bit, which we're pretty excited about, and that means less mandation and happier people. Nursing pretty much remains the same. All resident, care partner, and visitor incident reports were reviewed and trended and patterned, and our safety concerns are taken to the safety committee. Met with all of our new care partners in our orientation, and we have a few more nurses and CNAs coming on board. We continue to work with regional and county emergency planning groups, and tomorrow we have scheduled an emergency drill where we will be the recipients of virtual people coming to JCMCF after a disaster in Lansing. We continue to honor our staff for their anniversaries on Facebook, and that has gone over very, very well with our teams. And I just returned from attending the annual MCMCFC conference at Boeing, part of it. I came back a couple days early. Quality, trended and patterned all the data that we have on our incidents, making sure that we have all of our processes identified that we need to tackle. We are currently free of any survey issues. In the past 9 months, we've had 3 complaint surveys that were generated outside of our building, none of which were substantiated. One had 22 counts of this person being upset with us about 22 different things. Not one was substantiated. So that's pretty good. Considering our past pattern, it's pretty amazing. We continually review quality statistics comparing the outcomes to state and national averages, and we continue to be well ahead of the state and nation on antipsychotic medication use. We have 0 acquired pressure ulcers, and we have a very low turnover rate compared to our sister facilities. We continue to meet regularly and engage with Allegiance Hospital on a variety of ways that we can partner together and improve transitions of care. We have hired and filled almost all of our open positions. We have a few more nursing positions on afternoons, and a couple CNA positions just opened up. But overall, we're doing very well on filling them. The finance, MDS, and administrative teams have been working closely with Rehab Care Group. This is a big OIG audit area for this upcoming year to make sure that your assessment of individuals' ability to do their own ADLs ties out with the amount of therapy they're getting. So we've been monitoring that. We're working to obtain our Milestone 3 recognition through the Eden Alternative. There's only 4 of them, and we're also working on our Silver Award. We have a team that's working on that. And I thank you.
Thank you. What comments or questions might you have for Director Place? Thank you for that information.
Thank you.
Next on the agenda, we have the claims, May 1st through the 31st. We have a motion and support in reimbursing those claims. All in favor say aye. Opposed, the same. Motion passed. Under other meeting minutes, we have 2 DHS board meeting minutes, and we have a variety of other Region 2 area agency on aging. In addition, we have our July reporting schedule presented on board docs. That leads us to the second and final public comment. Is there anyone in the audience that would like to address us? Seeing none, are there any committee member comments? Commissioner comments? Seeing none, adjourn to the call of the chair at 1:03.